Okay, we're going live.
All right. Hello and welcome to the first regional report out call here from the Northwest region of the state. These calls, I'll give you start off with just a little brief background of why we're doing these and how they came to be and what to expect from them. And what the rhythm of them will be. So the state has been broken into 7 healthcare regions. This is something that KDHE did as part of their healthcare coalitions, and emergency management also uses it. We understand that a lot of you can get information as it persists on a statewide basis, or you can look at your individual counties, but healthcare systems really are regional as they move and operate. And a lot of people want to know what's going on in their region or in their neighborhood. The rhythm of the calls will be starting with public health and what's going on there. I want to I guess tell you before we start, everybody on here has had short notice of this standing up. We wanted to stand it up quickly and get information flowing versus trying to be perfect. I'm sure we'll get better each time, but all the people that are volunteering onto this call have done it on short notice, and I appreciate you all being willing to do that. But next week, KDHE start having a regional dashboard for us. And we have a dashboard that will be attached to this from the Kansas Hospital Association. We also have a dashboard from Mission Control starting next week, which is the software that a lot of hospitals in the state are using as it goes to transferring patients from hospital to hospital, which tells a part of the story too. And we'll be on here at the same time each Tuesday. You can watch it live broadcast on YouTube, or you can sign up on the website through the state, which is covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. You can sign up and get an email, which have the dashboards and this YouTube link, so you can consume this information when you're ready. Our goal here is to not be prescriptive or to tell anybody what we think they ought to do. We just want to get the same level set information out there about how the healthcare system is flowing in your region. This is designed for if you're in an elected position, you have to make decisions based on where the pandemic's at, or you're a business or community leader, or a concerned parent, or caring for older adults. We just want you to all have the same information of what's going on in your region. On these, and we're grateful for Governor Kelly and Speaker Reichman and Senate President Masterson, who all in a bipartisan way really endorse this effort of trying to get information out regionally to Kansans in a timely way. So every Tuesday this time. Now, we will not do live Q&A during these calls. We don't have time for it. We're trying to keep the calls between 15 and 25 minutes, and so they're more easily consumed. But you can write into ksregionalreport@gmail.com, ksregionalreport@gmail.com, and give us your comments or questions. Just tell us you're talking about the Northwest region of the state, and we'll try and work it into next week's time. I'll end each of these with a bright spot from the region, assuming we can get them. But the bright spots, these are pretty heavy calls. The information we're dealing with can be heavy week to week. And so we just want to remind people that you do have the ability in your grasp to try and bring a little more light into the world every day. And so we're finding stories of people doing that and just highlighting them just to remind us of the goodness that's out there too, as we talk about some of what we say in our organization is the lights shine brightest in the darkest times. So we're just going to highlight some of those lights. And we have some of those lights on this call here today. And so I'm going to start. We're going to kick it over to Jason Kennedy, who's in Ellis County, and have him give us a report as much as he can regionally, or what's going on there in Ellis from a testing and positivity rate, et cetera, from the ground of public health.
Sure. John, I appreciate you having me on the call, and for everybody listening, I honestly appreciate anybody that is reaching out for information right now. It is a trying time for everybody, and so as we all try to present the best information and really just get people to make those good choices. So as we look, I will be honest, I don't have a great regional view for you. Like I said, we kind of had short notice, and so we're all working through what we've got. I can tell you what we've seen in Ellis County. So in Ellis County specifically, Our highest, kind of our highest point in the pandemic, and one of the best numbers that I look at generally is our 7-day cases per day, 7-day average of cases per day. Our highest of that was 45 back on the 25th of November. And as of yesterday, we were down at about 18. So we have seen, modest improvement with at least our case rate, our case growth. We've also seen for the first time in a long time, we've seen our first sizable decrease in our percent of positivity. Our percent of positivity has been generally fairly high, but we have really focused on testing of symptomatic individuals. Our healthcare community has done a phenomenal job of providing extremely high test rates, really even compared to the rest of the state for Ellis County. So we brought on through the state's push with testing, we brought on really asymptomatic testing. We have a mobile site here. Well, it's a fairly fixed site now, but we do have that through the CARES money and through the testing at the mall. That has helped to reduce the percent of positivity because there are no stipulations. You don't have to be symptomatic. You don't have to be a contact of a positive. Really, anyone can go out and be tested at that site. It also has, it is a regional site. It's not just specific to Ellis County. We really encourage anyone to come be tested. What we don't encourage you to do though is come to the community, go to all the restaurants, bars, go into every store, in and out of every store, then grab a COVID test on your way home. That kind of defeats the purpose of the testing. So, and we get a lot of people that are like, well, I didn't think I was going to be positive. I was like, well, you got to plan for that. So plan first for that. But we do encourage anyone to seek out testing. The site's at the mall. It's free of charge, and it's open Monday through Sunday, actually, from 8 to 5, I believe, or they're out. Well, I think it's 8:30 to 4:30. But
and how quickly are you getting results there generally?
In the initial first run out, the test results were not coming back in a fairly efficient manner. But I do believe now that they've gotten those test results down to around 3 to 4 days of a return time. We would like to see that faster, but they are using an out-of-state lab. So those results, they say 48-hour turnaround time once the results are received at the lab. So you're looking at a day of transport time and then some logistical time built in. So really 3 to 4 days is kind of what we're seeing with that turnaround time. So if you're symptomatic, if you're symptomatic, go see your doctor. I don't know how hard I can push that agenda. Go see your doctor. Let your primary care physician really determine what needs to happen with your care. If you're a contact of a positive, you're not symptomatic, you're concerned, you're worried, you just want to know, absolutely, I encourage you to go to the drive-through testing site. But if you're symptomatic, go see your doctor. We've got a phenomenal medical community here in Ellis County, and our medical community serves the regional area as well. So go see your doctor, let them determine kind of what needs to happen or that best practice. But we have seen modest improvement, which is good. We are also actually have worked with the City of Hayes Water Department to do some affluent testing, COVID testing of wastewater. And so we actually have enough data at this point to start seeing some of those trends. And we do see a leveling off or a decreasing of the COVID in the effluent water or the wastewater testing as well. The limitation to that is that you can't like pick out a number in that wastewater testing and say, oh, at this number we have, 75 cases. Like, it doesn't quite work that way, but we are able to see trends. And so the good thing about the wastewater testing is it does show us what's going on in the community without that human aspect. It removes that testing or people not wanting to be tested because of quarantine or people not wanting to do this or that. It really removes that, and it gives us kind of more a true snapshot of what is happening in the community as far as COVID levels. So we do see a leveling and a slight decrease in that as well, which is good news for our community. Now, numbers are they're just numbers. They don't show the true picture or the impacts to families, to communities, to everything else of that actual positive. So we spend a lot of time looking at numbers, but we forget that the big thing is the impact of that number, that individual case, or what that looks like with the community. So it's a point in the pandemic where there's some light at the end of the tunnel, and that we do see vaccines starting to come out. We're hoping to have those here in our region. Obviously, we're hoping to continue to get significant doses of those that we can use to, for the first time, really have a tool to fight back against the pandemic instead of just kind of the defensive structures of the public health measures. So there is some light at the end of the tunnel, but we do need people to still to heed those public health warnings, continue to make good decisions, continue to do what they can to kind of protect themselves and their loved ones.
Thank you, Jason. That's really interesting and a good report, and we appreciate it. Next week, also, like I said, we'll have some KDHE summary reports on the Hospital Association report that'll be attached to this. You'll see a little bit of what he was talking about, where in early October, the week ending December 12th, there's 496 cases. In November, that had gotten up to 800 to 1,000. Most of that month, and here in the second week of December, it was back down to 517. So that is probably the most encouraging graph I've seen out of the 5 regional calls that I've seen so far today, and I back up what you're saying. So we appreciate that, and for giving us that perspective. Now I'm going to pivot to Reagan, if she can give us a update from the hospital perspective.
Good afternoon, everybody. I'm just going to do kind of like a quick overview. John had mentioned that there was a dashboard that is being prepared by the Kansas Hospital Association that will be available to everybody. And what they've done is they've broken it out into the regions of the state. So for the Northwest region, we're going to do, think of it like Rush and Ness, and then up to Russell, and then everything over to the Northwest, up to the Colorado border and up to Nebraska line. So that is what is included in that Northwest report. So what they're looking at is they collect all of this data from the hospital and the regions through the HHS teletracking program. And what you would see on today's is the most recent, which is from December the 9th through December the 14th. And it kind of gives you a snapshot of what you're seeing in that region when it comes to the number of positive cases. So total for that region, it is looking at about 9,718 positive cases. You have 5 of the 18 hospitals in the region are anticipating critical staffing shortages, which is about 28%, but comparing it to the statewide average, it's about 40%. You also have a list of, what do the ICU beds look like in the region? And so instead of me talking about what the region looks like, I am going to actually, if it's okay with you, John, hand that over to Eddie Herman, who's the CEO at Hayes Med, and let him talk about, and I think John's going to bring it up later, but we talk about stuff, staff, and space. And so we're going to let Eddie talk a little bit about the impact and the boots on the ground and what they're seeing at Hayes Med when it comes to bed space, transport, stuff, staff, and space.
Yeah. Well, thank you. I'll jump in here just to kind of lay a little bit of groundwork to give an idea for us being a tertiary care facility out in Western Kansas. And for us, we provide many service lines that we're the only provider in Western Kansas that has that service line, such as a lot of the cardiac stuff, CV, spine surgery, a lot of those pieces, large oncology group also. For us currently through COVID right now, we've had 373 inpatient admissions. I would say that in general, our inpatient admissions, Ellis County makes up much less than 50%. So typically about 60 to 70% of our admissions come from other counties in the state, or mostly Western Kansas. So we cover a pretty wide, swath of land out in Western Kansas where we draw into, especially on the critical care side. We've had 50 deaths out of those 373 inpatient admissions, which tells you that's about a 13.5% death rate among those who get admitted. So that's not That's not real good, but we're getting the sickest of the sick from all aspects of Western Kansas. One of the things that has led to is we're already very busy when it comes to the number of transfers that we typically see into our facility. On average, we see between 300 and 350 transfers on a monthly basis, which is really high for a facility our size, being 200 beds. And so we've seen that really swell. And so a good example would be the month of November. We saw 455 requests for transfer because of the fact that we're averaging, about in the month of November, we were probably averaging 32 COVID inpatients. And a lot of those, 7 to 8 of those would be intubated. And then we'd have another 7 to 8 to 12 that are on BiPAP. So they're taking up our critical care beds. So we had to close to outside admissions for large portions of the month. And it's not because we don't have space and we don't have more critical care beds. We don't have the staff. When you run a critical care unit that has an average daily census of 4 to 5, and you're now running 10 to 12 critical care beds, you run out of people who are trained to take care of those patients. So for us, staffing has really been the main factor that closes our facility. It's not space. We've got more rooms. We don't have people to take care of people in more rooms. What that also does then is I talk with Salina Regional as well as Hutch Regional almost on a weekly basis at this point, because it just becomes like a balloon. When you squeeze it in one area, it's just going to bubble up somewhere else. And so we try to make sure we're keeping each other informed when we are going on, a diversion where we're not taking any more critical care patients, because that means they're just going to get pushed down the road to Salina or to Hutchinson, Wichita, and vice versa. When Kansas City, Wichita, and Topeka get overwhelmed and their critical cares are full, they're coming to us. We've admitted patients from Oklahoma, Texas, Colorado, because there were no critical care beds left, and we happened to have one that opened up. So we've taken care of people from multiple states that are here for COVID. Last month alone, we had 161 patients that actually couldn't come to our facility because we were closed to outside admissions, which you hate to see, right? We have people that are in Ellis County that we know came in with COVID and they ended up going to Denver because at that point in time was really at the peak for the state. And so now that family's got to figure out how to get somewhere like Swedish in Denver. They're not, they won't allow anybody to visit, so there's no point in going and staying there. They probably weren't as accommodating as we typically are. We try to use technology to our advantage. We use a lot of FaceTime for people who are COVID positive and ventilated. So those are just some of the struggles that you have, and it just causes issues for everybody. And then on the other side, there for a while, and the state was really helpful in talking to nursing homes and skilled facilities. We were having a hard time getting people out. Our average length of stay when you're in here for COVID is 8.5 days. Well, our normal average is slightly below 4 or right around 4. So we more than doubled our length of stay just on those patients. So now on an average day, if we have 80 patients and 30 of those are COVID, those 30 are not going anywhere for a week and a half on average. So that means we're trying to work with patients who need emergent surgeries, urgent surgeries. It's the end of the year and people have deductibles and they really want to get their stuff done. And you're having to say, we probably can't do your total knee or your hip, even though you've met your deductible, because we can't guarantee that there's a bed for you to go to. So we've had to limit some of the inpatient surgeries, even on that side. It's gotten better, I think, as Jason's indicated. We've even seen that, we've come back down to a range of the we float between probably 24 to 32 inpatients. Our peak was 43. So basically 50% of our facility was COVID or higher on a weekend. It could be 60% of our inpatients were COVID only. So that's kind of what we're dealing with. Our positivity, we do a lot of testing here in Ellis County. And so we've done almost 15,000 COVID tests. We've seen it in the very beginning where we had very few cases and the positivity rate was really low. We saw a peak of a positivity rate that was around 40%. And then now we're back down into that about 27% positivity rate is what we've seen just this last week. So we do see it trending down a little bit, which is good. I think next week will be telltale when we go back and we look at July, after 4th of July. It was about 3 or 4 weeks from 4th of July that we really saw the peak of the number of cases for COVID. So, we're Thanksgiving and coming back into the Christmas time. And so we'll see if we start to ramp back up. Today had me thinking maybe we are a little bit. We were as low as 24. We're already back up to 31. And so, we may be seeing, and maybe it won't be as bad as it was in November, but it looks like we'll have a little bit of a surge there. So that's a lot of information, but we definitely will, I'll entertain. If you guys have any questions or something that I didn't cover, please don't hesitate to jump in there and ask. There you go.
That's 2020. You're muted. Eddie, thank you for that report out, and it helps bring color to this. And just hearing how the numbers have fluctuated today is something, I've really learned as I've leaned into this project, is how dynamic hospital environments are. A dashboard like we're sending out catches a moment in time, but things can get hot and heavy pretty quickly, or can decrease and swing for you. And so I just appreciate how flexible and elastic your teams have been, and the willingness to put in extra time. You may not know this, but of the 161 people you weren't able to admit in November, how many of those would have been, just your guess, from the Northwest region, and how many would have been from outside of that region trying to get in there?
Oh, I would probably say on average in the Northwest region, well, I say we really look at Western because we'll get Southwest and Northwest. So I'd say Western Kansas, it was probably 75% of them were probably requesting from that area. Would be pretty normal. Maybe a few to the east. If they couldn't get into Salina or somewhere, you'll see them kind of get pushed over here, but that's probably pretty normal percentages on what we see.
And you make a great point too when you talk about having to send people to Denver. I think we all tend to think we can get our regional healthcare regionally. We like it to be closer to home with the kind of people we run around with, and we're finding that people are having to go great distances sometimes to find those beds. So anyway, thank you for highlighting that too.
Yeah, no problem.
Well, so that was good. Reagan, anything you'd want to add onto that report?
No, I just thank you, Eddie, for on short notice being on and being able to help us out here. I think people forget that the health system, has multiple campuses, and we all work together to do everything we can to make sure that we have space for everybody. But I think Eddie points to something, which is, nobody wants to send somebody to Denver or from Hayes to Kansas City for a bed. And we really want to make sure people are getting their care at home. And Eddie, I do ask one question. I know we've talked, but we've had some issues in the past with transfers that you at Hayes or other hospitals in Western Kansas have needed to transfer out of our area to other areas and haven't been able to do that because those hospitals, say in Omaha, Nebraska, or other places, were closed to transfers as well because they were seeing peaks too. And so then we're in this scramble to find a place to put a patient.
Yeah, I mean, that's how you end up with, I feel really bad for the patients from Texas. I mean, that's a long ways to go, but literally at that time, there was not a single critical care bed left. It was really out of more the Panhandle area, so it's at least somewhat closer to us. But I mean, because they weren't going to go all the way to Houston, it's quicker to come up to us. But I mean, the whole entire state of Oklahoma didn't really have a critical care bed, and we were really the closest thing. And you always have that struggle. It's like you want to take care of people who are in Kansas. That's really what we're driven to do. But ultimately, we're just here to care for people. And if this was a much better venue, which it was, they were in a smaller hospital and they were struggling to manage the patient, it was the right thing to do. And we've done that for a handful of patients that are coming out of Colorado, Oklahoma. We've had multiple from Oklahoma and from Texas.
Eddie, thank you, Reagan. Jason, anything you'd want to add before I wrap it up?
No, I appreciate you having me on. Like I said, it's we'll all get through this together.
Yep. Well, I appreciate everybody. In healthcare, you guys are really working hard in your teams. As I've listened to hospital calls, I know there's a lot of burnout and stress on teams. And we're just hearing on the last regional call, just having to see more deaths per week in a significant way and how that wears on the teams. As Reagan said, it's staff, it's stuff, or it's space. And what's driving a lot of the issues now, it was stuff back in April. PPE material was the main driver. Now it's staff. Glad to see some trends going in the right direction. We'll be watching those with bated breath here. But as a reminder, these calls will be this same time every week on Tuesday. You can watch them live on YouTube, or you can sign up on the email on the website, which is covid.ks.gov/report-outs. Send your questions or bright spots to ksregionalreport@gmail.com. ksregionalreport@gmail.com. I'll end with our bright spot here. Students at North Central Kansas Technical are creating quarantine kits, complete with health information, basic supplies, and a few fun things too, with the goal of making staying in quarantine a little more doable for students. Being a person who's been in quarantine now for day 11, I can see how lovely that'd be for people to pour in like that. So just, people stepping in, trying to do something right to care for others as we're all trying to get through this. So if we can lock our eyes on how we can help, that'd make a big difference. Thank you all for being on the front lines for us, and we'll look forward to connecting next week.
All right. Thank you.